So in that way, speed videos helped me a lot to way to focus in that topic. Speed GTs were very helpful. I did all the GTs which were in the speed app. So those questions were really helpful. It's a great database of questions, I can say. They helped me to where should we focus in the actual topic, and also make clear of the guidelines platform, because it helped me to clear my thinking about what they are asking in the exam and all.
I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Tahir Hussain for scoring a topmost rank of 15 in DM Respiratory Group and 127 rank in Critical Care Medicine. Congratulations to you, Doctor.
Thank you, sir. Thank you so much, sir.
So great to have you in this session. Thanks for your time to allocate for you to share your valuable experiences with us and also for this purpose. Thank you.
Honor to speak to you, sir.
Thank you.
It's my honor.
Can we get started and to know where you started your career from? What is your brief background history? Can you share something on that? What have you accomplished?
Uh, Sir, I'm Dr.P.Thaher Hussain from Kurnool, Andhra Pradesh, sir. I did my UG at my hometown only, sir, in Kurnool Medical College. Then I did my PG in MD Respiratory Medicine from SV Medical College, Tirupati. Uh, so that's my background, sir. Now I
Okay,
have.
super, excellent. Congratulations. Great accomplishment. And when an idea for you to do a DM pulmonary medicine started, and once it started, how all you worked towards it and achieved right to a topmost rank?
So initially, I was not focused on DM Pulmo, sir. Initially, I thought maybe I'll stop with MD respiratory medicine. But as I joined my residency and saw the subject and saw the possibilities and the depth of the subject, then I thought maybe DM Pulmo will be a great thing to go beyond in my parent subject, sir. So that's why I thought it in like my second year of residency. I thought maybe I should do DM Pulmo.
Great, great. So what are your preparation strategy that have you worked in the background and the back end to get this rank in the front end?
So initially, I focused on my clinical things, because in residency, our residency it's a government medical college and it was hectic. So both my first year and second year, there was not much time to read or prepare for this NEET as such. So I focused on my test books, sir. So like Fishman, we were Fishman, and then there were those were the things which helped me a lot, and also the clinical residency as such. Then in the third year residency only, I started to along the side of my preparation for my prof exams. I was also focusing on like what to read for, where to focus on for this NEET and INI.
Great, doctor. Wonderful. Now, can you comment on the paper? What you felt about the paper? What they were concentrating on? And how many questions you were able to answer in that paper?
So this time the paper was like, okay, sir, I might tell that it is moderately easy. So they were focusing more on the topics like it was more of a textbook kind of thing only. Fishman, they were asking core Fishman topics, and if someone is well versed with Fishman, I think they can answer almost like 120 questions, maybe 100 to 120 questions they can easily answer if they are well versed with Fishman. And they were also focusing directly they were diagrams or the images were directly taken from the Fishman textbook. And there was also critical care part in the exam as well. So critical care and also guidelines. So the tables from the Fishman. And the core topics like ILD and asthma COPD. Also the guidelines, latest guidelines, whatever the latest guidelines which have come, they were focusing more on that. So I attempted like I think one question I left, sir. So I attempted 149 questions.
Great. Very nice. Very nice to know. And what is the message that you want to give for the future aspirants of DM Pulmonology Group and Critical Care Medicine Group?
I mean, should first focus on the core concepts. Try to read main textbooks as much as possible. Then be versed with the latest guidelines which are upcoming. Like if for my subject, the gold guidelines, the GINA guidelines, the pulmonary hypertension and embolism guidelines. These should be the main thing where you should focus on and start as early as possible. And just before the exam, like at least before 6 months of the exam, start giving GTs at least I started giving GTs 3 months before the exam. So GTs, speed GTs were very helpful. I did all the GTs which were in the speed app. So those questions were really helpful. There is a great database of questions, I can say. Almost there are some 15 to 16 GTs, 15 to 16 GTs. Uh,
Great, doctor. Very nice to know. And I also want to share, ask you, what was your experience with speed for this exam in preparation?
So, sir, actually, I came to know that speed in my third year of residency, and at the end of third year of residency, only after the completion of my exams, I uh, saw videos, and especially Saurabh Bahuja sir's videos were top notch. They actually they helped me to where should we focus in the actual topic, and also sir make clear of the guidelines, and also the GTs, as I was telling before also. So GTs were all very helpful. And these, especially in my preparation, I read the textbook, but I didn't know where to focus in that particular topic. So in that way, speed videos helped me a lot to where to focus in that topic.
Great, doctor. Time to thank and whom all you feel that you want to thank. They stood by you from day one till date and helped you to make your career.
Sir, I would like to thank the Almighty, my parents at my parent institute, which is SV Medical College, Tirupati, our HOD sir and our faculty, assistant professor sir, Baz sir, Subbarao sir, and all the faculty, they were very helpful. Right from the beginning of my residency, like the academics were good. They were pushing us to know the latest information and the latest procedures at what is all there in this pulmonology per se. So, and also to my friends and family members who have stood by me there for all this throughout my journey, sir.
Great.
And
And
also, I would like to thank the Speed platform, sir. I should really thank Speed platform because it helped me to clear my thinking about what they are asking in the exam and all.
fantastic. Thank you very much for sharing it. And
Thanks.
once again, we wish you all the very best and all the success
Thank you,
for
sir.
a great and wonderful and amazing career for a DM
Thank you.
Super Speciality in Pulmonology Group. Best wishes to you, doctor.
Thank you, sir. Thank you so much.